call the roll.
Commissioner Marecki,
Here.
Commissioner Dobb,
Here.
Commissioner Anderson,
Here.
Commissioner Baker McCormick,
Here.
Chair Colleen.
Right here. Thank you.
You have a quorum present.
All right. What's next, ma'am?
B, approval of the October 6, 2020 meeting minutes.
Pleasure of the committee.
Move approval.
Thank you, Commissioner Dobb.
Support, Marecki.
Thank you. It's been moved and seconded to approve the October 6 minutes. All in favor of the motion, please say aye.
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 Aye. Opposed? All right, Madam Clerk, let's roll the agenda.
C, old business. There is none.
Excellent. Next,
Item
please.
D1. Item D1 under new business, requesting commission approval of Amendment 1 to a 3-year professional services agreement with Valley Services.
Okay, administration, who is presenting this today for our congregate and home delivered meals?
Joan Savrakis, Division Director, Senior Services Department.
Welcome.
Thank you, Commissioner. This is an amendment to the 3-year contract with Valley Services for the provision of congregate home delivered meals to our senior citizens.
Okay, our annual contract.
This is a 3-year contract that
3-year, yeah.
And this is an amendment to it because when we initially secured the 3-year contract, the projected amount of meals and dollars were underestimated. So we're amending the contract to cover the additional expenses incurred for the first 3 years. And there are 2 1-year options to renew this contract, which will be forthcoming.
Okay, and Ms. Savakis, when do you need this approved by?
Well, Commissioner, as soon as possible. The processing of this amendment was significantly delayed. Anything that could have gone wrong probably did go wrong with this. So as soon as.
Okay, because, you know, we moved last week's full board meeting to this week. We're all geared up for the things that are going through committee right now to go on the November 5th full board meeting. Would that present a problem to you, Ms. Savakis?
I have respectfully requested Pam Lane to consider adding this to the full board meeting schedule for the 22nd, if at all possible. This didn't quite make the last committee meeting, and we received a notice from Mr. Rainwater that it didn't quite make it. So we're respectfully requesting some consideration for Thursday's meeting, if possible.
So
If Ms. Lane is on the call,
Yes.
Chief of Staff for our policy and research, is that possible, Ms. Lane?
Hi, this is Pam. Through the chair, I did speak with the chair about these issues, and it would be her preference, unless there is a dire emergency, for the items considered at this week's committee meetings to go to the November 5th full board meeting.
Okay, yeah, thank you. You know, and I also want to thank not only commission staff, but administration staff. This is very difficult times with everybody working remotely to get the day-to-day business of government done. So I'm going to go back to you, Ms. Savakis. Can you live with November 5th, all things considered?
If that's the pleasure of the commission.
Okay. Well, I don't know if it's our pleasure, but that's what we're going to do.
Okay.
Okay. Questions from committee members on the Valley Services contract that provides food for the congregate and home delivered meals. Let me go around the horn here. Commissioner Marecki, do you have questions on this item?
yes, I do. Thank you. Thank you, Mr. Chair. Joan, so our congregate meals ended, what, in March when COVID hit? So, and nothing's been restored as far as I know. So how does that affect this contract if the senior centers and stuff don't open up for another 4 or 5 months?
Commissioner Marecki, through the chair, our congregate meal operations at our nutrition sites were suspended in March. However, we have been providing drive-up congregate meal service since April 14th to our congregate meal participants. So congregate meals are continuing, just not in the manner that they used to.
Okay, so these senior centers, isn't that considered congregate meals as well, or not?
They are the nutrition sites that accommodated individuals to come and enjoy their congregate meals. So all the meals currently delivered by Valley are being delivered to the congregate meal.
Oh,
So
okay.
the individual sites have accommodated us and stayed open. So we were able to receive the meals and distribute them to either congregate or homebound seniors.
Okay, and so have those numbers, I know the homebound obviously has stayed, those numbers have stayed up, but how about the congregate ones? Are they about the same numbers as it was back in March?
Actually, we provide about 200 congregate meals. We deliver, or they drive up and they get a 5-pack of meals, and we're serving about 200 participants every week.
Okay, all right, thank you. That's all I
You're
have.
welcome. You're welcome.
Thank you, Commissioner. Commissioner Dobb, questions on this item?
No questions for me. Thank you.
Thank you, Commissioner Anderson.
All set.
Commissioner Baker McCormick, Vice Chair.
No questions.
All righty. Well, I'm glad that everybody's still getting their meals, even though it's by an alternate method that we haven't had people drop off. Okay, what's the pleasure of the committee with this item?
Move approval, Anderson.
Support, Marecki.
Anderson moves, Marecki supports. All in favor of item D1, please say aye.
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 Opposed? Are there any abstentions? All righty. Thank you. And thank you, Ms. Savakis.
Thank you, Commissioner.
We're moving to the addenda, I suppose, Madam Clerk?
Yes.
Okay, first, what do we have first?
Item D2 on the addenda, requesting commission approval of modification 1 to a 3-year sub-recipient agreement with the Arab Community Center for Economic and Social Services.
All righty, thank you. We actually have 2 items, this one and number 3, which relate to the WIC program and where they're housed. Who's introducing? Let's take them together if we can. Who's introducing this from administration, please?
Hi, Commissioner Colleen. This is Carol Osterberry, Health Officer, Health, Human and Veteran Services. And I have these items for the background on these.
Okay, welcome.
So, yeah, thank you. So each of these agencies is a subrecipient of Wayne County. They provide for the WIC program services. They provide WIC program services to residents, you know, in the area. And they have been long-standing subrecipients for WIC program services, do a great job. And this is the modification 1 to the 3-year subrecipient agreement. And they are for 2 years. Yes.
Say that again. We are doing, we have a 3-year agreement.
Right. And then this is under the agreement, then this gives us this modification, which will allow for 2
Yeah.
1-year extensions.
You want to take both extensions right now?
Yes.
Okay. If Commission Counsel is on, any problems with taking both 1-year options right now?
Through the chair, this is Felicia. So the issue with these 2 contracts for WIC is that the contracts themselves did not include the renewal options. So it was explained to us that the intent of the department and the entity in the state was to actually include renewal options, but they were not included in the contract that was approved by the commission. Corporation
And that-
Counsel, I'm sorry, go ahead.
No, I was just going to say, Counselor, and that's in the language that we received on our agenda saying adding 2 one-year options to renew.
But the problem is that the way the contract document is written, it doesn't say we're adding, it says that we're exercising as if they were included in the original. And that was the conversation, inquiry I made of Corp Counsel, because you cannot exercise an option to renew that doesn't exist. So instead of drafting this contract to say, to explain that, that was the intent and that was in the RFP, we're adding, they actually is written to say that they're exercising it, which again, you can't exercise that which doesn't exist. And Corporation Counsel gave some explanation as to why they thought that it was appropriate to do so. We disagree. We reviewed the law and things that they referred to. Don't understand again how you can exercise that which doesn't exist. It would have been a very simple contract language change that did not occur, that they did not make. But it's my understanding that I guess all the parties, including, I believe they said they spoke to someone at the state, that they're all in agreement with this method, which is questionable from a legal perspective, in my opinion.
Thank you, Counsel. And I'll go back to Ms. Osterberry, but maybe if Corporation Counsel is on, let me go back to Commission Counsel. Commission Counsel, is this something that can be rectified in 2 weeks for the next HHS committee meeting?
I will have to defer to the department. We raised this issue over a month ago, and it has not been addressed by any of the parties, by the department. So I'm gonna have to defer to them as to why it hasn't been addressed or if it can be. It's a simple fix, but I don't know what their reason is.
But in your opinion, it can be fixed in the next 2 weeks?
Oh, absolutely. It's a simple language change.
Do we have, I want to know 2 things from administration then. One is, if this appears on our agenda 2 weeks from now, is there any irreparable harm that is caused by that?
Hi, this is Carol. No, we can, go back with Corporation Counsel and have that. I don't know if Corporation Counsel is on to offer any other comments.
Okay. Is somebody from Corporation Counsel that worked on this in committee today?
Yes, TR Winter, Corporation Counsel.
Yes, sir.
Yes, we've worked on this. We were aware of the issue in August and had already spoken with the state about this program, which is, a federal program that's administered through the state, about the length of time in it, and the extensions were included in the RFP, which was included by reference in it. And we went to the state and said, should this length of time that was procured be what the length of the contract ultimately would be, and got assurances from them that that was correct in administering the program.
Mr. Winter, is there some issue with amending the contract as suggested by Commission Counsel?
We have had a couple of communications with Commission Counsel, including in writing and then a conference call. We had not heard of a specific request to change the way the contract is written in that manner before, but we believe it is acceptable under procurement law and the funding source. That was not discussed specifically until today about potentially changing it to remove that word that it's exercising the options. But our position has been, not specifically having a suggested change, is that the options being in the RFP is specifically that we're exercising the specific ones that are there and were included by reference.
Well, you're hearing it now, Counsel. Because the point that our council is making is you can't exercise something that's not in the contract. So.
And our legal
Well,
response.
Mr. Winter.
Mhm. They are in the contract through the RFP being included by reference. And we did a very full workup of that with the procurement law and then had a discussion. And this asking the language to be changed was not, specifically suggested.
I understand that, Mr. Winter. What I'm asking is, can we
Chairman
change the?
Colleen?
Yeah, go ahead, counsel.
Because just for clarification, so the concern of this office was put on record and it's remained the same. So obviously, just like any other issue, if we raise it to the department, it's then up to them to determine whether or not they're going to address it. So we don't go back and say, make this specific change, but we do raise the issues. But with regards to the RFP, I just want to be very clear about this. The RFP can contain something, and what we're now suggesting is that if it's in the RFP, but it happens not to be in the contract approved by the commission, somehow it still is interpreted to be in the contract and then can be implemented. The merger clause in question was very generic, but a merger, and I don't believe that it actually incorporates the RFP, but even if I assume that it did, that doesn't mean that the RFP supersedes the contract. Usually when we talk about which documents control, it will be the contract that controls over the RFP. And that's the way the Corp Council writes their standard contracts. So even if we accept the explanation, which I don't agree with, that the RFP is incorporated, the RFP doesn't supersede the contract that this body approved, which didn't include the two renewal options. But again, it would have been a simple contract fix. It was just a matter of how they wrote it, saying that they were exercising something versus adding something.
Okay. Thank you, counsel. Mr. Winter, I'm going to go back to you, and then I'm going to involve other committee members in this. Regardless of what's gone on to this point, Mr. Winter, I'm asking you a very practical question. Can Corporation Counsel amend the contracts themselves to include 2 1-year options or 1 2-year option, whatever you would like to do on that, and then bring this back 2 weeks from now for approval. Just on that specific narrow question, regardless of who's talked to the state and who's called and conference calls and emails that have gone back and forth, can Corporation Counsel amend these contracts to put the options, either 2 1-year or 1 2-year, in there and bring it back for approval in 2 weeks? Is that possible, Mr. Winter?
I mean, it is legally possible to do that. I would have to consult with my boss and other people about that. Our position is that the contract is solid and binding the way that it is, and that's what was discussed.
Well, let me bring and see, now when you say that was discussed, I don't know what to do with that statement. Let me bring other commissioners in on this for their thoughts on this. Commissioner Marecki, you have any thoughts on this?
I would like to follow with all due respect, follow what Felicia says, because I'm not a lawyer, but it makes great sense to me that how can we approve something that wasn't even there? So I don't know if we can pass. What do we do? Pass it for the day, or?
We could. It would come back on our agenda at our next meeting then, yes.
I would go for that.
Okay.
Personally.
All right, Commissioner Dobb, your thoughts on this?
I agree with Commissioner Marecki. I would like to pass this for the day and include the language that was advised by Commission Counsel.
Thank you, Commissioner. Commissioner Anderson, your thoughts?
No, I'm in support of doing that also.
Sorry?
I'm in support of doing that also.
Oh, okay. Thank you. And Commissioner Baker McCormick, your thoughts or any questions you have at this point?
No questions.
Okay. What is the pleasure of the committee then?
I move to pass this for the day.
Would that be items D2 and D3, Commissioner
Yes.
Marecki? Yeah.
Yep.
Or Anderson.
And Commissioner Marecki has moved to pass for the day items D2 and D3. Commissioner Anderson supports. I think we've had discussion, commissioners have indicated. So I'll go right to a vote. All in favor of the motion, please say aye.
Aye.
Aye. All opposed, please say nay. Are there any abstentions? Okay, well, we have a date in a couple of weeks then, Mr. Winter, and let's get it done then. All righty, thank you.
Yeah.
Madam Clerk, what's next on the agenda?
Item 4, requesting commission approval of retroactive modification 5 to a collaborative use and occupancy agreement with 2 one-year options to renew with Oakwood Healthcare.
Yeah, thank you. Who from administration is introducing this, please?
Sorry, hi, this is Carol
Oh,
again.
it's going to be you, Ms. Osterberry?
Right, and I'm
Okay,
not,
two things
Mhm.
as you introduce this. One is please address the retroactivity, and then also just this physical layout. This is a funny kind of thing, you know, where we own 2 rooms in this bill, you know, that we've been doing. So if you can, you know, just explain the real estate that's involved here, and then actually what we do there.
Right,
If you can.
yes, I can explain, but I don't understand why it is being called retroactive, because this is still in effect until October 31st.
Okay, commission staff, do you have explanation about why it shows as retroactive on my agenda?
Hi, this is Chris Albrecht, policy analyst for the Wayne County Commission.
Yes, sir. Welcome.
Mr. Chair, I did not work on this item in particular. From looking at the squib here, though, and thinking about our retroactivity clauses in the procurement ordinance, that's a good question.
Okay.
I'm not sure. I see the term does begin November 1st, 2020. That could be perhaps if it's going to full board on the 5th, and then obviously the 1st comes before the 5th. That could be perhaps the source of the retroactivity.
Okay.
Again, I didn't work on the item, but this is me jumping in here to try to deduce what I can based on what I know.
Thank you, sir. Thank you for that. And we'll go back to Ms. Osterberry then if you want to get into the meat and bones of this.
So at this location, 26650 Eureka Road, there is a, Wayne County actually owns Suite B. We own that part of the complex of the office, you know, complex there.
We have
Wayne
a condo in there.
Yeah, just about. And so then in part of that suite, Oakwood Healthcare leases the space from Wayne County to provide services for the Oakwood Taylor Teen Program. So that is why this is a lease for, you know, between Oakwood Healthcare and Wayne County. They pay us to be, you know, rent that lease or, you know, rent that space.
Okay. Thank you. Let's go around to commissioners. Commissioner Marecki, are you ready for some questions?
Nope, I'm all set. Thank you.
Thank you. Commissioner Dobb.
No questions, thank you.
And thank you. Commissioner Anderson.
No questions.
Thank you. And Vice Chair Baker McCormick.
No questions.
All right. What's the pleasure of the committee on this item then?
So moved.
Commissioner Baker McCormick moves it.
Ford Anderson.
And Commissioner Anderson supports. All in favor of the motion on item D4, please say aye.
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 All opposed, please say nay. Are there any abstentions? All righty, thank you.
You're welcome.
Thank you very much. Madam Clerk, item D5, please.
Item 5, requesting commission approval of Amendment 2 to a 3-year comparable source lease agreement with 2 3-year options to renew with Joseph Compost Shops.
Okay. Who's introducing this?
I'm Coaches from Wayne County Healthy Communities. Good afternoon.
Oh, Mr. Coaches, good to see you.
How I hope everyone is safe.
Thank you. You too.
This is an extension, our second extension of a lease agreement that was written, I guess, 6 years ago. This is the second of the two extensions that were included in that contract. It goes into effect on November 1st of 2020, and it goes through October 31st of 2023. Same building, same spot, same price.
Okay. Are you sure those options are written into the No, that's all right. Now this raises the question that we just had. This is a start day of November 1st, and the commission meeting that will consider that is on November the 5th. Does anyone see that provides us with any difficulties?
Commissioner Killeen?
Yes, sir.
This is Chris Albrecht again, policy analyst for the commission. I would just like to state that in this case, we have a grant-funded agreement, and therefore the retroactivity does not apply.
Because of the grant.
Correct.
Thank you very much for that clarification. All right, we'll see what questions commissioners have. Commissioner Marecki, you're up first.
All set.
Thank you. Commissioner Dobb?
No questions.
Thank you. Commissioner Anderson?
All set.
And Commissioner Baker McCormick, do you have any comments or a motion?
So moved.
Thank you. Is there support?
I'll support Dobb.
Thank you. Commissioner Baker McCormick moves item D5. Commissioner Dobbs supports. All in favor of the motion before us, please say aye.
Aye.
Aye. All opposed, please say nay. Are there any abstentions? All righty. Thank you, everyone. Madam Clerk, what is next on our agenda?
Item 6, requesting commission approval of an intergovernmental agreement with the Detroit Wayne Integrated Health Network.
Okay. Do we have somebody from DeWin, as we say, the Detroit Integrated Health Network with us? Or who is introducing this?
Hi, this is Cecily Hoagland from Juvenile Youth Service Division.
Yes, ma'am. Welcome.
HHCS. Thank you. Cecily Hoagland, Administrator, Juvenile Youth Service Division, HHCS. The item before you is an intergovernment agreement between the network and the county to provide funds for mental health and substance abuse assessments and treatment services for at-risk and court-ordered youth in Wayne County.
All righty, thank you. And for the old timers, I'll point out that the Assured Family Services is the new name for what we used to call the Juvenile Assessment Center that does all the intake and recommends, does the assessments and recommends the services that our youth should be receiving. Any questions on this? We'll start with Commissioner Marecki, please.
So this is, does this money, how does this money, does it come down from the state through, is this state money?
This is money from the state Medicaid money that comes to the network, and then the network, then it comes to the county, and then we in turn, we will add these funds to Assured Family Services contract, and they provide the services for the youth.
Okay, and do we get like updated reports on how this money is spent, and is it audited by the state, or do we audit it?
We have had, it has been audited before by our Office of Auditor General, I believe, a couple years ago. And we also get audited by the, I believe the state audits Jouett, and Jouett audits us.
Okay. Because this is for a year, correct? This is a yearly. All right, so 3 million or almost 4 million a year. Okay, so there are ongoing audits. It's some place or another.
Yes, there are ongoing audits, and we get reports from the network as to the number of youth that are served.
And what they're, do we get outcomes on that?
I believe we do get outcome data. I'll have to check and make sure, but I know we get data on the number of kids that they serve for the assessments and the GIF.
Okay. All right, thank you. I'm all set.
Thank you, Commissioner. Commissioner Dobb, you have questions?
I don't have any questions. Thank you.
Thank you. Commissioner Anderson, how about you?
Not a question, but a comment. What I spoke to you about earlier, and I know it's not related to this particular item, but I wish to let the Detroit-Wayne Integrated Health Network know that we're experiencing some issues with a facility that I'm sure Commissioner Marecki probably is familiar with, St. Louis Center, that some financial issues. So I just want basically to put them on notice that this organization has done a tremendous job with those that are developmentally disabled, someone that need individuals that need care 24/7. But anyway, I'll save that for later, but I just wanted to let them know that there's issues arising from their changes of policies at the Wayne Integrated Health Network, internal and administrative changes they're making. Thank you.
Commissioner, at noon tomorrow, the board of the Detroit-Wayne Integrated Health Network meets. We would certainly welcome you at public comment at the board meeting tomorrow. Commissioner Baker McCormick, you have any questions here?
No questions.
All righty, thank you. Ms. Hoagland, before we go to a vote, I have, so we get a pot of money for, in Medicaid dollars for our youth, correct?
Correct.
How big a pot is that? Is this all of the money? Do we spend all of it with this contract for Assured Family Services?
Well, it's based on the number of kids that they served. And I believe one of the commission questions was how much of the money did we spend last year? Last year we received $5.2 million. And all that money wasn't spent for services. I'm not sure how much money will be spent for this fiscal year. But in the past, we haven't spent all of the money that we received. At least last year, we didn't spend the whole $5.2 million.
So you have a discussion with the state of Michigan on what you think you're going to need for these services.
Well, I think it's the network that has a discussion with the state.
Yeah. Okay, I gotcha. But it's not like, because we do other things with youth in this county and we have other expenses. It's not like we get, a $15 million pot of money in Medicaid for youth. And then this is only, 3.8 million of a larger pool of cash. This is our of Medicaid dollars. This stands on its own. Is that correct?
Yes, this is for like GIF assessments, target case management, and for kids who have serious emotional disturbances.
So we go to the state specifically for this, not any other service, at least under this grant.
Yes.
Okay. All right. What's the pleasure of the committee on this item?
I'll move approval. Daub.
Thank you, Commissioner. Is there support?
Yes, support.
Thank you.
Marecki.
All right. Thank you, Commissioner Marecki. We have Commissioner Dobb moving, Commissioner Marecki supporting. All in favor of item D6, please say aye.
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 Aye. Opposed? Say nay, please. Are there any abstentions? All righty, thank you. Hey, let's go to another
No, thank you.
addenda. Thank you. Let's go to another addenda then, Madam Clerk. What do we have here?
Item 7, requesting commission approval of the appointment of Michelle Jouett to the Detroit Wayne Integrated Health Network Board.
All righty, thank you. We had a few months back, one of the county executives members appointments decided not to take a reappointment. That was Ms. Gada Abdallah. And that goes back to a few months back anyway. So we've been anxious as a member of the mental health board, and the mental health staff has been anxiously awaiting to get another person to have a full complement on the board. So this is what we were waiting on today, why we were late to get this before us today. So thank you for everyone's patience. And who is going to be introducing this on behalf of the administration, please?
Good afternoon, Mr. Chair. Andrew Kandrivas from Wayne County Executive Warren Evans office.
Welcome, Mr. Kandrivas.
Yeah, thank you to you and to your wonderful staff for getting this on. I know that it was rushed and we were waiting for this, but I don't want this body to think that the selection was rushed. We had been speaking with Ms. Jouett for many months now, and I'm sorry, it feels snake bitten sometimes. I'm trying to get things into the system. So I take full blame for that, but thank you very much for putting this on today. We do have available on the Zoom call Ms. Jouett, and just so you know, Michelle Jouett currently works for the Dearborn Public Schools. She's a school psychologist. And T.R. Winter, who is Corporation Counsel that you know very well, that handles all the DWIN activities. And I have had several conversations with Ms. Jouett, and we believe she'll be an excellent complement to the slate we have already at the DWIN board to join you. So with that, I'd ask Ms. Jouett if she wants to just introduce herself, if that's okay with you, sir.
Well, I will call on her in a moment, Mr. Kandrivas.
Great.
Just to get it here, because it was late to the agenda and we held up the meeting, the conversation that was going on behind the scenes was that there's requirements under the mental health code for who sits on these boards. Of the 6 appointments that the county executive has, 2 of them have to be primary or secondary consumers of mental health services. So I know there was a lot of checking and questioning going on to make sure that we are in conformance with the mental health code with this appointment. So what I would like to do to kick this off is to ask Corporation Counsel, I guess Mr. Winter worked on this. Mr. Winter, can you attest that this appointment conforms to the requirements in the mental health code?
Yes, T.R. Winter again from Corporation Counsel. Yes, with every appointment, we review all the requirements for primary consumers, and the mental health code has now changed, and rather than being called secondary consumers, they're now called family members. They have gotten rid of that phrasing, and we also check, and commission staff was checking as well about SUD board, that enough members who are actual board members are on the SUD board. And yes, we are in compliance overall with all of those things at this point and with this appointment. And thank you.
Yeah, because that change in the language to family rather than primary or secondary caused a little confusion. I would ask Commission Counsel whether Commission Counsel is in agreement that this appointment conforms to the or recommended appointment conforms to the mental health code.
Through the chair, so we rely heavily on the department. My office doesn't keep track of each appointment and who fits which criteria. But we
gotcha.
were advised by the department that the individual, that the criteria necessary under the code have been met. So we have no objection.
Thank you. And I should also comment that I did a little last minute checking over at the Mental Health Authority as they are aware that this appointment is coming, and they are also comfortable that it conforms with the mental health code. So with that, Mr. Kandrivas, I would ask that Michelle Jouett join us here and tell us about herself a little bit and why she wants to take on this board.
Hi, I'm Michelle Jouett. I am thankful for this opportunity to serve on this board. I've been working in special education for 18 years now, and I've had some family members dealing with some of these issues and kind of try to help navigate them through the system, trying to get them services and the help that they need from the community resources that are available. So it's just something that I'm very passionate about, helping marginalized people get the services that they need. I'm a wife, I'm a mother of 4 and a grandmother of 2. So I guess it's just a little bit about me between family and home, and I'd like to have the opportunity to just do some kind of public service as well. So I appreciate the appointment or the potential appointment. I appreciate the nomination and look forward to working with everyone.
Thank you. And you just confirmed there, Ms. Jouett, since you have family members that you're help getting services, that under the old language of a secondary consumer, that the mental health code, that covers you as well. Let's see what kind of questions committee members have for you before we go to a vote. Okay. Commissioner Marecki, will you have questions?
No, I don't have any questions, but welcome. And I'm sure with your background, you're going to do a great job.
Thank you, Commissioner.
Thank you, Commissioner. Commissioner Dobb, do you have any questions?
No, I don't. Thank you.
Okay, Commissioner Anderson.
Just congratulations on your willingness to serve, or thank you for your willingness to serve, and congratulations, to which I suspect you'll be confirmed quickly.
Thank you, Commissioner. I appreciate that.
Thank you, Commissioner. Commissioner Baker McCormick, any questions?
No, just want to say welcome and congratulations.
Thank you.
Well, I guess I'll do the grilling then. Mr. Wad, the Mental Health Authority, or the Detroit Wayne Integrated Health Network, is aware of your possible appointment. This will not go to the commission for final approval until November 5th. So your appointment, should it all go through, would not be until the board meeting in November of the Detroit Wayne Integrated Health Network. So that's the timeline here. I hope that we do have a board meeting tomorrow at noon. I don't know if you've been communicated with and have the link to join us for that, but if you could, that would be great.
I don't yet, but hopefully
okay,
someone will send it to me.
We will get that to you. So this is very much a working board, Mr. Wad. You will have the full board meeting. You'll have a couple of committee assignments. So you're going to be looking at, and there's a lot of work in between committee assignments. We deliver $830 million worth of services to the severely emotionally disturbed, developmentally disabled community, as well as in substance use disorder services. So there's, and as you've heard already, some discussions, around the JAC. So I'm interested in two things. One is there going to be any problem? I think you could assume somewhere on the order of 10 hours a month. And the other thing is I would just like to hear a little bit more about why this appointment floats your boat and you really want to dig in on this.
Okay, so the 10 hours a month should not be a problem at all. Why I want to do this is I've been on this side of it to where I've been a family member trying to help people get services, and I've been in my employment. I mean, I'm primarily located or, placed in a high school setting, and that's an age when a lot of mental illness starts to kind of show up, and try to, connect my students with services as well. So it's just, I guess it's just something that I've just always done and have been doing for quite a long time. So I'm just interested in the role of the other side of it, kind of like looking for good quality services and putting resources towards those so that the people and the consumers can have better services, I guess, is kind of where my interest lies. I don't know if that answered your question or not.
Well, it does, right? I mean, you just want to hear from people's hearts what, you will go through a little bit of a board training and know more about the mental health code than you ever thought you would ever know about the mental health code in your life, as well as, I mean, this is no small operation at over $800 million a year.
Mm-hmm.
So it's not just, it is our reason for being, whatever that French phrase is, raison d'etre or whatever. Is services to individuals, but it's a big bureaucratic organization too, that involves everything from evaluating our CEO. I mean, it involves a lot of things. And so look forward to working with you.
I'm ready and eager to learn as much as I can, and also hopefully to be, an active contributing member.
You will have that opportunity. What's the pleasure of the committee on this recommended appointment?
Move for approval.
Thank you, Commissioner Anderson. He moves it. Is there support? And Commissioner Marecki, I think, supported. Yep. All right. All in favor of the motion before us, please say aye.
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 Opposed, please say nay. Are there any abstentions? All righty. Well, welcome. Welcome to the madness.
Thank you.
Look forward. I think I have your email in the paperwork, and I will forward you the full board for tomorrow, Ms. Jouett. So you have the, we like, for some reason, at the authority to use Blue Jeans and not Zoom. So, whatever.
Okay.
But anyway, I'll get that to you today so you can use the link, and then before we vote on November 5th, you can decide, yeah, I do want to join this, or I don't know. But anyway, we'll get that to you. Thank you very much, and
Thank you.
look forward to it.
Thank you.
Madam Clerk, what's next on the agenda?
E, such other matters as may be properly submitted before the committee.
I have none. Does anybody have some such matter to properly submit?
Nope.
Hearing none. Next, Madam Chair, or Clerk, or whoever.
Public comments.
As far as we know, do we have any emails that were sent in, Ms. Lane, for comment?
We have not received any emails.
All righty. And do we have anybody on the phone, any member of the public that's on the phone? If you wish to have comments to the committee, now is the time.
Commissioner Killeen?
Yes.
This is Lisa Whitmore Davis. I wanted to make an announcement to the public.
Thank you. Please remind us of your title, ma'am.
Thank you, sir. My name is Lisa Whitmore Davis. I'm Director of Senior Services Department. I again first want to thank you for your gracious consideration for our item that was taken up today. The reason for my purpose of the announcement is on October 29th at 2 p.m. We're very excited that we're working closely with our health department colleagues to provide a session in the senior services community senior virtual education seminars that we've been having. So we're having session 4, and the topic is senior safety, senior wellness, and flu protection during COVID-19. Our experts at Wayne County Health Department have put together an outstanding virtual engaging presentation that we hope that members of the public would participate in. It's through Zoom, and you can join it by phone. If anyone would like to receive that information, they can email our department at seniornutrition@waynecounty.com. Again, seniornutrition@waynecounty.com. Chairman Colleen and also to the other commissioners, I've emailed it to you all individually so that you'll have that flyer at your easy disposal. But thank you for the opportunity to make this announcement.
Yeah, and thank you for sending that, Ms. Whitmore Davis. Did all commissioners receive that?
Yes, they should.
Okay. And so I'm going to recommend that now you've said this out loud and in public, if you could just do that one more time to remind people that 3 days ago in their inbox, they received this.
Okay.
Yeah, that would be great.
Thank you so much.
Any member of the public wish to address the Health and Human Services Committee? Do we have any member of the public? All right, hearing none, I will move the agenda. What's next, Madam Clerk?
Adjournment.
Okay, pleasure of the committee. Well, I guess they've already adjourned.
No, I move adjournment.
Oh,
We're still here.
okay. So what do you
Support.
want to do?
Move adjournment.
There you go.
Support.
Take the bull by the horns and support. The chair rules that with no objection, we stand adjourned. Thank you for the patience today, folks. Thank you very much.